So in October of 2018, Governor Cardee signed Executive Order 24, making Delaware a trauma-informed state. And in the order, he outlined some expectations for all state agencies, including the Department of Correction. And that included things like making sure all staff were trained to recognize and respond to trauma, to make sure that we had strategies in place to promote the resilience and well-being of our staff, and to make sure that we had evidence-based practices, good treatment services, to help those who had been exposed who are in our service system. So the executive order requiring state agencies to be recognizing and respond to trauma is very relevant for us here at the Department of Correction, particularly because we know that many of the people we serve, whether they come in directly to probation, whether they're coming in and being served in our facilities, that often people who come in contact with the justice system have very high rates of exposure to trauma. And that is often both trauma in childhood, but also in adulthood as well. And so we know that we have to be able, across our system, to recognize and respond, that by doing so we can help people really promote healing and recovery, which helps them to be successful. So because we know so many people who come into our system may have had trauma experience, it really is important to do universal screening for everyone, to ask everyone who comes in the system. And so we have processes in place both in the community for people on probation as well as for people who come in our facilities, to early on be asking questions about whether they've had experiences with trauma exposure, looking at whether that exposure is currently impacting their health and well-being, and then making sure we connect them to care. So in the community, probation officers are working with individuals and can connect them to care through an electronic referral system. In our facilities, our contracted behavioral health service providers can also provide direct services to address trauma that people may have experienced. So we have that screening and treatment in place. But we also want to actually expand the different types of treatment interventions that we're offering. And so as an example, several months ago, we launched a partnership with a community provider called Pause for People to bring animal-assisted therapy into Baylor Women's Correctional Institution. We know that the experience of trauma can create a sense of loss of safety and control, create high levels of stress that can really be chronic. And so bringing in this animal-assisted therapy program actually is an attempt to create a sense of safety for the women there, to provide them a stress relief intervention. And actually we've collected some feedback from participants, and actually what the women have told us is they really have found it to be very therapeutic, that they report kind of feeling less stressed, better able to manage stress when it does occur. And really we want to continue to build on these other kinds of interventions as well. So we have a pretty broad continuum of things that we know can help people. Two things I want to highlight, things that we want to build kind of moving forward. One is really the use of peers. So in a trauma-informed approach, we know that people who have lived experience are in a unique position to work with individuals who have had exposure and are being affected. They really are in a unique position to help work with people and promote their healing and recovery. And so we're looking at how we can expand the use of peers across our facilities. In the community as well, there are peer support programs that we can connect people to. So peer support is one. The other is we recognize that for women who come in our system who may be pregnant or who are parenting, and particularly parenting young children, that the experience of incarceration, being separated from their child if they give birth during their incarceration, the impact on young children of separation from a caregiver, that all of these can potentially be traumatic. And so the leadership at Baylor Women's Correctional has recognized this and is working to address this, and really trying to develop an expanded approach to better supporting women, their children, and their family and friends in the community who may be caring for the children during that person's incarceration. And so looking at how do we try to minimize the trauma of someone delivering and being separated from their child? How do we increase opportunities for visitation, for example, for children with their parents, particularly those young children, where we know that they are especially vulnerable to exposure to trauma? Looking at, how we can build parenting capabilities, because again, recognizing that often that experience of early exposure can impact someone's ability as a caregiver now as an adult, and really trying to break the cycle that we know can happen across generations. The work at Baylor is really looking at trying to make an impact there. And so those are two things we're looking to do, and certainly additional things we want to add in the future.